Good evening, Dr. Phil here. A friend of mine recently recommended this useful website to me, which discusses guidelines for COVID-19 care from leading global health authorities and consolidates them into a single recommendation based on concordance. Collaborators includes NEJM Group, UCSF Group, and COVIDprotocols.org. There are several legends. The green bubble indicates recommended strategy. Red bubble indicates not recommended strategy. The grey bubble with red dotted outline indicates not recommended strategy unless in clinical trial. The orange bubble indicates uncertain strategy, and the grey bubble indicates no recommendation. Treatment strategies may be filtered by topic such as management of hypoxia, therapeutics in COVID-19, PPE, outpatient care, severe COVID-19, critical COVID-19, and also level of evidence A, B, and C. Treatment strategies are categorized into 3 categories. Category 1 is do, Category 2 is inconclusive, and Category 3 is don't. The content is categorized as do, don't, or inconclusive based on the criteria described below. For the do criteria, more than one guideline currently supports this practice or therapy, and no guidelines currently oppose this practice or therapy. For the don't criteria, more than one guideline currently opposes this practice or therapy, and no guidelines currently support this practice or therapy. For the inconclusive criteria, only one guideline addresses this topic in support or opposition, or multiple guidelines make recommendations that are not in alignment. Information presented here is intended to be educational in nature and is not a substitute for clinical decision making based on the medical condition presented, and it is the responsibility of the user to ensure all information contained herein is current and accurate by using published references. This website is last updated on July 7, 2021. Treatment strategies under the do category includes IL-6 inhibitors such as tocilizumab, systemic corticosteroids, protocolized lung protective ventilation in COVID-19 ARDS, standard dosing of DVT or VTE prophylaxis, vaccination, neutralizing monoclonal antibodies for non-hospitalized patients, high-flow nasal oxygen, prone positioning, wearing a mask in public, NSAID use if clinically appropriate, N95 or equivalent for aerosol generating procedures in COVID-19, home pulse oximetry for monitoring symptomatic patients with high risk of disease progression, PCR testing for persons with suspected COVID-19, and antigen testing for persons with suspected acute COVID-19 if PCR testing is not available. Treatment strategies under the inconclusive criteria includes inhaled corticosteroids, baricitinib or JAK inhibitor, convalescent plasma, remdesivir in severely ill COVID-19 patients, remdesivir in critically ill patients on ventilators, intermediate dosing of DVT or VTE prophylaxis in critically ill patients, PCR testing for de-isolation of hospitalized patients, empiric antimicrobials in critically ill patients, surgical or medical masks for routine COVID-19 patient care, non-invasive positive pressure ventilation for COVID-19 patients, favipiravir, fluvoxamine, and molnupiravir. Treatment strategies under the don't category includes ivermectin for treatment or prevention of COVID-19, aspirin, hydroxychloroquine for prevention or treatment of COVID-19, therapeutic anticoagulation in ICU patients with critical COVID-19, therapeutic anticoagulation in patients hospitalized for non-critical COVID-19, colchicine, azithromycin, empiric antimicrobials in non-critically ill patients, neutralizing monoclonal antibodies in hospitalized patients, ACE inhibitors as treatment for COVID-19, stopping chronic ACE inhibitor therapy on admission for COVID-19, PCR testing for de-isolation of patients in non-healthcare settings, NSAID discontinuation, famotidine, lopinavir or ritonavir, and antibody testing for persons with suspected acute COVID-19. I hope this website will be useful in guiding therapy for COVID-19 in your center. Thank you.